Eastern State Hospital was just the second psychiatric hospital to open in the U.S. and this very month, marks the 200th anniversary. That's a huge deal.
It is a huge deal. And Chief Administrative Officer Lindsey Jasinski joins us to tell us the history of Eastern State Hospital and how we can bring awareness to mental health. We appreciate you so much for being here. And you know what? It's almost kind of fitting that this is the 200th anniversary because May is Mental Health Awareness Month. All of this kind of ties in together.
It does.
So let's talk a little bit about the history of Eastern State first, and then we'll go into more of that.
Absolutely. Well, thank you so much for having me to talk about this. I love the hospital. I've worked there for many years, and we're super excited to be celebrating our 200th anniversary. So Eastern State Hospital opened May 1st, 1824. Hard to imagine at that point. There was a woman from Woodford County that was admitted as the very first patient.
Wow.
Since that time, it has obviously undergone several different name changes and had upgrades to care. And in 2013, we actually built a new state-of-the-art state psychiatric hospital here in Lexington. We continue to operate there today. It's a beautiful facility and allows us to provide the best evidence-based care to our patients.
And so I'm even noticing as years has, moved on, we are really focusing a lot on mental health.
Yes.
Even into present day, a lot more people are taking off because of mental health.
Yes.
Tell us a little bit about why it is so important to acknowledge our mental health nowadays.
Well, first of all, I'll say mental health is health. Just like any other part of healthcare, mental well-being is as important for our overall resilience and day-to-day functioning. We know that mental health affects our physical health in lots of ways, both positive and negative. And so it's important that we bring awareness to this, which is why we have Mental Health Month, to understand that mental health is important to take care of. Stigma oftentimes prevents people from seeking the help that they might need, and it allows us to get into a crisis state when maybe we could have gotten help earlier and gotten support in a different way. So it's really important for us to focus on that as much as physical health.
Yeah.
Oh, it absolutely is. So let's talk about, when does someone need to try to get care? What are the signs? And again, you say there's a stigma around it, so sometimes we don't follow up and we know something's not right. When should we go?
Absolutely, great question. So when you notice that day to day you're having more hard days than good days, and for a couple of weeks you've noticed things like sleeping patterns are different, eating is different, hopelessness, difficulty doing everyday things that you used to enjoy, you just don't feel that way. If that lasts for a period of time, that's a sign that you need to check in. There's something that we could maybe do to help support.
So what's the website that we need to go to? How do we find more information?
Absolutely. So UK Healthcare has done a lot of work around behavioral health in the past couple of years and has an awesome website with tons of resources, tip sheets for managing stress, anxiety, and depression, working with teens who might have a high level of stress or symptom burden, and talking about suicide. All of those resources are located on the website to get more information.
You know, we've learned so much. You know, it's much more than just teen angst. You know, when we're talking
Definitely.
about the children of that level. You know, we have to pay attention a little bit more because more and more reports of that are coming out, and it's great to have such a resource like this in the community to help us out. We appreciate you so much.
Thank you. We're glad to be here to help the folks who need us.
Thank you so much for being here.
Thank you.
And of course, if you do find that you are struggling, having an issue,
Absolutely.
you can call the Suicide Crisis line at 988.
Absolutely.
Yeah.